Hi, welcome to You Didn't Get the Memo with our guest, Dr. Moshe Lewis. You guys, about 8 weeks ago, Dr. Lewis and I did an episode called Your Health Matters, and we were talking about COVID-19. And since that, we've gotten a lot of questions. People are inquiring just all types of questions. And so we decided what we would do today is that we would come back and we would address some of those questions. Look, I'm going to punt the ball to Dr. Lewis, and I'm going to tell you, we talk about this being a candid, lit, raw conversation. Look, the questions that people are asking, I'm certain that the one who sent it in, they're not the only one who has these questions. And so I'm going to bring Dr. Lewis in, and we're going to talk about these questions. Dr. Lewis, thank you so much for, jumping back in, and let's do this COVID-19 update, and let's just keep it candid, lit, and raw, the way people are talking about. How you doing today?
Oh, doing great. Thanks so much for having me. And you're right. I think that so many questions continue to spiral about. Some of us may have hoped, certainly the medical community did, that we would get a break and that things would quiet down. We were definitely very hopeful for that. And certainly we have to admit that some of us are surprised that it isn't quite gone away and it's not quiet. So we want to make sure we had some time, like you said, to address those questions and just
Right.
ball through the park.
So I'll start off with what I thought was one of the easiest questions that a viewer asked, and that was, can you still get just regular sick, or is everything corona?
Right, exactly. It certainly seems all that we're talking about. I was just looking today, and it's literally almost 20,000 articles that have been published just in the medical community on COVID and corona. So it is true, you can still get that. I get calls every day of the week, and it's either true all hours of the day and night. And many people do have, I'll pick just today's cases. In the last 24 hours, I had a case of tonsillitis, a case of a strep, and a lady yesterday who had a urinary tract infection. So, and we send them out for tests to kind of make sure it's not, because there are a lot of different symptoms. But short answer, we want to keep aware that there are some other things that people can get, and make sure we stay on top of those. But certainly thinking about COVID, it should always be on our minds because there's so many different symptoms one can get.
Yeah. All right. So, and I'm just going down the list. So the next question was sex and COVID-19 with partners. And there was a question mark, safe or unsafe. But the caveat was with new partners or if you're creeping. And I love that. I can't wait to hear your response to that one.
Exactly. I know many people are trying to keep some things on the down low. And we heard through the grapevine, of course, not through personal experience, that this was certainly ruining some affairs, especially when people got quarantined. So we may not fully be able to go there. But it is interesting. In Europe, there was a law passed about this, and I don't think it's easy to enforce. And we may leave that up to them. With your partner, person you've been with for years, for sure, you have already been in the household. The same thing applies to your family and things of that nature. The people that you're around and you congregate with that are in your household, doing things with them, having dinner, certainly with your partner, having relations and things like that, fine, no issue. It does become a risk as we start to interact and interface with our neighbors or other friends, and certainly other people, in terms of if they may be sick or things of that nature. So we're trying to discourage people from getting together in large groups, and there's going to be some risk. I've had many people sit and say, "Hey, I'm going to get tested before I fool around," and I'm not mad at you these days. In general, the quarantine period on the higher end is 14 days. So 14 days if you're in, no symptoms, you've kept your distance in that regard. They don't have symptoms, you don't have symptoms. You're okay to certainly have relations. You don't want people to feel like, okay, it's not safe to have sex. It's okay, especially if they don't have symptoms and it's been a couple of weeks.
Yeah. Well, I think the rule of thumb is If you're creeping, getting tested before doesn't mean anything. So you just really have to be very, very cautious about that. So thank you for so eloquently addressing that particular question. And so to the person who posed it, hopefully they will be able to act responsibly. How about that? Next question. Group gatherings. You know, the numbers started out with basically, it wasn't even something that was suggested. Then it went to groups of 10, groups of 20. And the question was, what is it now? Is it 10 or less or 20 or less or what?
Right. So there is some variability, because it's true. Some of the people that may be listening in, and we see you out there, Arkansas and Michigan. We appreciate you guys tuning in today. Feel free to throw your questions in the chat room, and we'll get them. And if we don't get to them on the show, I promise we will stay up all night till we answer them all. But so there are some states where things are much quieter. There's not a lot of activity in terms of seeing cases and infections and hospitalization rates. And in those states, certainly groups may be a little bit larger, and it's certainly going to be okay. In the hot states that everybody's hearing from, we're in California, we're leading the list with number of infections. New York is still high, even though certainly in terms of any major issues that did exist this spring, things are quieter. But Arizona has lit up a bit and now is beginning to start to quiet down. Texas is certainly still a hot spot, Illinois, Florida. So in these places, we say you do really have to proceed with caution, like you just said, act responsibly. So do I really need to have the family reunion, the family gathering, get everybody together in a large number, especially if there were older people, and I'm putting that at 45 and above, that have medical issues, even if they're mild, asthma, diabetes, liver disease. It's really not worth taking the risk right now. And it's better that we stay safe than we marry ourselves to a number like, oh, well, they said 20 and I only have 16. Well, 16 people may be too much if you're in a state that's hot and where there's a lot of infection right now. Our calls from Florida have been off the chart. We haven't been able to keep up with the calls.
Yeah. And the thing is if people, even if it's 16, 15 or 16, if they don't all live in the same household, you don't know who else they've been around or what they've been exposed to. So you definitely have to proceed with caution, I would say. So thank you for that. The next question was about restaurant workers. Restaurants are opening up. And one of our viewers said, I noticed that restaurant workers are passing out reused menus that other people have touched. How can I be assured that the menus are sanitized, and if there are any suggestions for serving meals? And that's a real one, because I see that the restaurant workers are passing out these menus, but are they being sanitized? So what do you say to that, Dr. Lewis?
Yeah, well, talking about creeping, people that know me know that I'm a secret foodie. And so I have creeped out to a couple of places to see what they're doing for research, but also just to get out and about a little bit. I will admit that one of the most innovative places I went to, and we'll give a shout out for Visalia, talk about somewhere not always thought of, had a what they call a QR code, a little code that you scan with your phone and you can pull up the menu. All the young people know what these things are, and I have the app and I had it. If you don't have it, of course, you got to download it. Long story short, there's really nothing to touch. So that's definitely an innovative approach. I've seen people themselves, because a lot of restaurants aren't doing that, having a pair of gloves that they wear, and I know people really want to be safe. And it's hard if you're there and you want to dine out and you notice that they are reusing a menu. It is not really going to be possible to start an argument. That's not the best approach. Several places are using a paper posted menu that you can see it when you first come in, or that they will tell you about, but they won't put anything in your hands. So you are right. I'm seeing different cities, different establishments taking different approaches. Those are just some of the ideas. And like I said, I went out myself to sort of see firsthand. And I do think it's best that we not touch things that other people have touched. Really, it's just too risky right now. And at worst case scenario, we can ask them to tell us what's on the menu and not touch it.
Yeah, and that QR code that can be downloaded. So for those of you who have older parents, or as you want to call them, the OGs, look, help them download the code. They go to an app store. Some of them are saying, "What's an app store?" But you can actually do that, and that's good to hear, Dr. Lewis. I had not heard that, so that's pretty cool. But here's the next question for you. Someone said, I noticed that POTUS was wearing a mask after all his rhetoric about not having concerns about COVID. Does this mean that he has contracted the virus and his office isn't telling people that he actually has corona? What do you say to that?
Right, sure. Well, I think that they're certainly never going to tell us that he has it if it was even possible. But we are seeing a change. I think that once some of the very key staff that the president and some of the people in the cabinet interfaced with started coming back positive, all of a sudden it got real, like we said. And it certainly exists with the Brazilian president who also came down with this, Boris Johnson who came down with this, some news commentators. I mean, it's serious. And so I think that all the recommendations that the staff, specifically the White House, need to wear masks eventually, came up to the level of the president of this is a little bit hypocritical to be polite that everybody on the staff has to wear a mask, but the commander in chief doesn't. I think it communicates solidarity and commitment and sincerity. If you do it, I don't think it should be sometimes on, sometimes off, and we're going to see some of that, unfortunately. We really need a consistent message. So I don't think that he has it. I don't think we learned that if he did. And bottom line is that with everybody around you starting to get sick and getting infected, it's a good idea to mask up, be safe, wash those hands, disinfect. You need to protect yourself, all of us.
Yeah, absolutely. News reports are now coming out that are saying that air conditioning units could spread COVID-19. What are your thoughts on this? Because it's hot around the country. People are experiencing, 80, 90, 100 plus degrees weather. And of course, they're running their air conditioners. To hear that, I'm curious myself as to what you would say to that. What are your thoughts on that?
Sure. These kinds of things can concern people, and we're not trying to say that this is all false, but balancing out the information. So if you're in a large apartment complex and there's air conditioning versus I have a home that we don't have open to anything else, it's just the fresh air, that's a very big difference in terms of risk. So I don't think that people need to feel that they need to swelter in the heat if they have AC present. But that said, now is a good time if there ever was. Let's change those filters. Let's have somebody come out and take a look if that's possible. Certainly, those people that are younger than 55 have a lower risk. And while they may get some of the symptoms, they're not going to get the severe disease. Now, we're dealing with someone who does have asthma or diabetes and they're higher risk. We might want to take those precautions to really make sure the filter is clear, that it's inspected. It's just good to be safe all around. The same exists. Corollaries to this would be toilet bowls and when you flush it, and when you're washing your hands, someplace public or not, changing contact lenses, all these places where somehow water or air could get in, certainly do increase our risk a bit. We think the exposure throughout the world is obviously super high. Many, many people that feel fine are going to test for it. So I just think taking those extra precautions, those extra steps, as opposed to feeling that, okay, well, I can't have my AC on at all. Again, very different situation if you're in a closed system where the air may not be as fresh versus if you're, open to the general, much larger space.
Yeah, this is kind of off. It's in with that question, but it's just something that came up for me. What about air purifiers or humidifiers? I know some people do that, and I'm not trying to suggest that people need to incur a big cost, but is that something that they might also consider as having some type of humidifier or something like that in their home?
I think it's a great question. We've done that in our offices. So we went and looked for purifiers and sanitizers based on some of the things that some of the other industrial companies were doing, the airlines, the trains, and things of that nature, because we do have some flow in the office and we wanted to increase it. We felt like we couldn't have all the windows and doors open all the time. That becomes a privacy issue. So there are things on the market that are moderately available and affordable. And certainly, I encourage people to do those. I think that if you're taking steps to be cautious and cleaning and disinfecting, having a purifier, things of this nature, checking the air vents, changing the filter for the AC and things of that nature, that's certainly not a bad idea. That said, we don't want people to be in a spirit of such worry and paranoia that they feel that literally they almost can't breathe. It's not quite to that level of seriousness. I've several patients who have not literally been out at all in many months. And so I think that's the ultimate level of trying to stay safe. But for those of us that are in and out and about and things like that, those simple things that we can also forget, but we should keep in there, like wash down surfaces, wash our hands, take showers, maybe 2 or 3 a day, things of that nature, wash our clothes, have a change out of clothes, are just as important as some of the bigger things like let me look at all the different sources of air that come into the home.
Oh, okay. Also, Dr. Lewis, this is kind of a two-part question, and some, people saying that you sound a little muffled. So when you respond to this, one has to do with the fact that Bill Gates had come out and he's basically said that the U.S. has made serious mistakes in its response to the corona pandemic. But this coming from a man without, who doesn't have a medical degree. But the other part of that was even with a couple of vaccines, and there are several that are being developed, there's no evidence that the vaccines are safe, will save lives, or prevent the virus. And usually clinical trials have people involved in them. Do you think people will get these vaccines? Will they opt to get these vaccines that they say are in the works?
Sure. So the answer to many of these is yes, people will opt to do it because there is a risk, there's tremendous risk still, especially for populations that are older. In terms of perfection, there is no perfect vaccine, we know. And so I think that many people who are younger or don't feel they're at risk, they are going to be more cautious for sure. And that's always a big challenge with going very quickly to develop a vaccine, that it's not perfect. That still said, the goal would be that all the data is available, we're getting to see it real time, and we know exactly how effective it was. And for each person, it is going to be a personal decision about whether they want themselves or a family member to get vaccinated. And we do realize that that is something that everybody will have to decide. The general recommendation, however, will be that if you're older and if you're at risk, you have underlying disease that for the same reason you might get a flu vaccination, that if the numbers are supportive of this being a greater benefit than risk, that people obtain the vaccine. Will that probably happen before this winter is well underway? Realistically, probably not. And so I think it's still a very early conversation for people to be worried about how useful it is or how effective it is, literally in the next couple of months, because the trials are still ongoing. And this is the reason for taking the time to try to go through these trials carefully. We do want to make sure, and we do want to try to be careful that the benefit makes it worthwhile.
Right. Another viewer just posted, is there a new strand of coronavirus that is less deadly than COVID-19?
Sure. So that's a great question. People have heard the word mutations. They're small. It changes. That as the virus sort of replicates itself, this little thing may change or that may change. We don't believe that there have been such serious mutations that we have a whole different strain, but we are seeing a lot of different symptoms and a lot of different presentations because we have such a large number of people affected. And this is something that's always existed in medicine. If we pick any disease, several people will have very mild symptoms, many may have moderate, and only a few may have severe symptoms. So that doesn't totally surprise us, but we don't want to try to imply that it has so drastically changed that it is very different in terms of the way that one would approach it, which is still to wear the mask, wash your hands, keep the physical distance, and then do a reasonable disinfecting process, especially in high traffic areas, bathrooms, kitchens, places like that.
Okay. All right. Guys, we really, really appreciate all of your comments. And as Dr. Lewis has said, you know, if we don't get to all of your questions, that we most certainly will respond back to them. And I want to assure you that we most certainly will. We are, you know, past our time limit, and we appreciate the questions. Keep them coming, keep them coming. We're going to respond to them. As you can see, as with anything, technology, we're having some technical difficulties. And the thing is, I'm really hoping that you were able to get answers to a lot of the questions that you sent in and requested. Let me just tell you that you can actually send your questions to you, the letter U, didn't get the memo, at gmail.com. We will share those out. We will get them back to you and respond. But this has been great. I appreciate all of you who have actually tuned in and have, you know, sent questions and you have concerns. That let us know that you're thinking about it. It lets us know that you are, you know, seeking answers, and for that we are truly grateful. I want to say to all of you who have tuned in, we want to thank you so much for tuning in to our show today. We will get back to you. We're trying to at least get back and respond, if not every couple of weeks, to questions and concerns with the raw, lit, and candid update on COVID-19. So thank you guys for tuning in. We really, really appreciate it. Until this time, in next week or a week or so, I want you to be safe. I want you to be sure and practice excellent hand washing, wear your mask, practice social distancing, and most of all, to just be safe out there. Be well. God bless.